have everyone's attention? This emergency room and everyone in it is now under quarantine. We're hoping none of you have been exposed, but a serious respiratory virus has infected 3 patients.
What? This can't happen.
We're starting everyone on antivirals just as a precaution. We'll also be bringing in food and water, so if any of you have any dietary restrictions, please let us know now.
Can't make us stay here.
That's right. I can't, especially not if someone's seriously ill.
We are legally entitled to keep you for as long
They
as...
locked us in. Are we locked in?
Oh, no way. I gotta get out.
Sir? Sorry. Like it or not, no one's leaving.
The decision to implement the quarantine was made after consultation with the board. The CDC has been kept fully informed and will be proceeding in accordance with all protocol.
Shaun Morgan and Lim are in there.
And our patient is out here.
Still no sign of the donor. He's not answering my calls. Asked my contact at San Jose PD to do a home check-in. Park. He's down there? How? Yeah, put him on. Security. Kellen's stuck in the quarantine. I'll pass along anything I hear from San Jose PD.
Tyler started coughing.
Let's up his antiviral, start high-flow oxygen and Zosyn to counter any underlying infection.
Santa Pete has a sigmoid volvulus. He needs surgery very soon. My call ended 37 minutes ago. I'm supposed to be somewhere else. It's important.
No, it's not. We need a non-surgical fix to a bowel obstruction. Anyone? Murphy? You got something?
Not really.
Anything at all, please.
We usually make a hole and come at an obstruction from the side, but we can't. We need to use the existing holes.
An endoscope are staring right through the bowel.
A saline enema doesn't. And it might untwist the bowel.
Simple, but it could work. Nice.
I'm fine.
Do you have your inhaler?
Of course I do.
What are you doing down here?
This isn't my fault. If you hadn't been working...
Kellen, I know you must be scared.
I'm fine.
I'm keeping this hat on for luck.
Here we go. Threading the tube into the rectum. Now slowly push the saline.
It's not a pleasant experience.
I'm getting some resistance to flow. I must have reached the obstruction.
Push harder. Hang in there, Pete.
Call me Santa. Ah!
Keep pushing the saline.
I'm sorry, Santa.
Feels so much better.
311 bus. $6.35. Left on Blossom Hill. Right on Cottle Street.
Dr. Murphy?
Left on Santa Teresa.
I think there's something wrong with him.
Pregnant woman a mask?
Kelly, can you hear me?
It's empty.
Kelly!
Freddie.
Dr. Resnick needs you.
He's not answering.
Dr. Murphy!
Don't yell. It'll only make it worse.
Okay, what should I do?
Tell him about the surgery. Give him every detail you can.
Santa Pete has a torn IMA. He's hemorrhaging into his belly. His BP is at 87/54 and dropping.
Saphenous vein graft. We can repair the IMA with a graft from the saphenous vein. We just
I don't need a diagnosis. I need an extra set of hands. Get me a 2 silk, vascular clamps, and an 11 blade.
Clear. Charge 200 joules. Clear.
We just saved his life and violated his rights. We could lose our licenses.
You won't. You were following the instructions given by an attending.
No, I wasn't.
Let's get him stabilized so I can go to Andrews and talk to him about getting him some marrow so this wasn't a waste of time.
Keep your lips together and breathe like you're blowing out a candle.
Cal, deep breaths, deep breaths. Hey, you doctor, right? Any update on the virus?
Do I have it?
No rest, no fever. This is your asthma.
When can we go home?
Your lungs are hyperinflated.
Better send in more doctors because that weirdo melted down.
Hey, Ray, shut up! Shut the hell up! We have multiple people in serious condition, including a senior doctor and my son. Your question's gonna have to wait. I need a nebulizer.
It's in isolation with the infected patients. I'll order one in from pharmacy. Making your own nebulizer?
Something like that.
You broke in?
No,
Dad, I saw the taser.
I didn't use it. Just threatened to.
That was dumb.
Long deep breath.
You got her on maximal oxygen?
Yeah, her vitals have recovered slightly.
The CDC is sending a PCR test based off the virus in the Malaysian outbreak.
So what's their treatment protocol?
Antiviral, steroids, inhaled nitric oxide, and anti-TNF receptor antibodies.
That's what we did for the 2 plain patients and Tyler.
We got to Dr. Lim sooner. That should make a difference. How's Dr. Murphy?
He's fine.
I saw his breakdown on the security feed.
Better. He's closing on Santa Pete.
Do you have a strategy for dealing with him?
Dr. Park and I can...
Park's in there? When did that happen?
Just a few minutes ago. He came in to help his son.